Okay, I'm going to be talking about practice leadership. Now, traditionally in our services, and I'm sure most people will agree with this, we've just kind of let staff get on with it. You know, we've got different aspirations, but basically let staff just get on and assumed that they know what to do. In good services, if people have got challenging behaviour, good services will make sure that their staff are carefully trained in protective techniques, physical intervention techniques. And very often those services will get trainers in. Is that why I'm getting on? Get trainers in, skilled trainers, and will often develop their own staff as physical intervention trainers as well. So that side of things has very often become quite well established. When we're talking about implementing PBS, we're talking about something which is very, very different. Because the whole point of PBS, as you've been hearing all day, is to improve quality of life, to prevent challenging behaviour from happening in the first place. Which means all of the other time when people aren't engaged in challenging behaviour, that is where PBS and active support needs to be in operation. Now, what we found from research is what distinguishes good services from not so good services isn't necessarily the style of house, the style of building, etc. It's actually what staff do on a daily basis. How they plan their work, how they interact with service users, what kind of direction, what kind of focus their work has, how planned it is. It's actually very detailed work and very skilled work. But staff teams are actually very diverse bodies. Often staff work on shift, they work at different times. Often managers are far away, managing lots of different sorts of services. And often staff don't get together, they don't see what one another does, and this leads to inconsistency. And as we know, inconsistency leads to challenging behaviour, etc. Now, research on good services shows that effective services have very clear approaches that they follow. They have very clear organisational structures. They get consistent staff performance. And what is the key factor is that they have good leadership. And this is where practice leadership comes in. If you think about the PBS process, we know that there's preparation. Now, preparation is understanding the person, is doing the function assessment that Sandy was talking about before for people with challenging behaviour. It's understanding the person just through person-centred planning or whatever. Now, that can include external people. You can often get external people coming in to help. Better if they work with internal people as well. Then there's the planning process, prescribing the approach. Things like the PCP goals, PBS plan development, active support plans, etc. That too can include external people and internal people. Always better if it's internal people. When it comes to implementation, it's always internal. It's what the service, the actual service delivery needs to do. And this is where the leadership of the service kind of comes in. So, key function of practice leaders is in that implementation phase. They may be well involved in the other phases, but that is where their job really sits. And that's to do with training staff, it's to do with ensuring accuracy of implementation, and it's maintaining quality of that service delivery. It's making sure all the planning bit, the prescribing bit, gets put in place appropriately. So, this is actually getting away from administrative leadership. Now, I know a lot of services are having a lot of problems this way because managers are being asked to manage more and more and more settings. They're often very distant. But this is something we actually need to fight against. Managers, as practice leaders, they need to be champions of the service. They need to be promoting the approach, promoting PBS, promoting active support. They need to be skilled themselves. They need to be able to get their sleeves rolled up and actually do the job that their staff teams are being asked to do. They don't want to be sitting in an office. They want to be sitting there working alongside their staff, seeing what their staff are doing. They need to be teachers because they need to be training staff. They need to be role models, leading by example. Now, Andrew Guy was asked just before lunch, had they hit any barriers? How did they actually get staff to do active support? How do they actually get to implement it? And his response was that he worked alongside them. He actually works with them. He actually sees what they're doing. He role models. What his answer just showed him up as the prime practice leader. Perfect example of practice leadership. So I'm going to focus on the practice leader responsibilities of training, which is helping staff to understand what they need to do to provide the correct support. Not assuming that staff know how to do it, but making sure that they are helped to understand what they need to do. Once staff are trained, accuracy needs to be checked. Again, you've got a diverse staff group. So a practice leader needs to have an ongoing role in ensuring that staff implement the plans, the behaviour support plans, active support plans consistently. And that is an ongoing responsibility. The other side is quality. Practice leaders need to be supporting their staff team to set and achieve standards, because it isn't just the direct work with staff, with service users. There's a whole bunch of other things that need to be done in order to support that work. And that will denote the kind of quality of the service. Now, in the same way that we don't get good, effective services from just letting staff get on with it, we also don't get good practice leaders if we just let managers just get on with it. Managers need the tools, they need the structure as well to help them be good practice leaders. You can't just drum it out of thin air. So they need the structures, they need the systems. Service systems need to actually support the practice leaders in this. So I'm actually going to go through each of these aspects briefly before I run out of time to show you some strategies and some tools that we think are pretty key elements in the practice leadership toolbox. The first one is training. Now, some of you may be familiar with this pattern. This is a 3-stage training model. Traditionally, traditional training methods, like this here, may be interesting, maybe not. You may be wanting to fall asleep. But often we do this kind of workshop, didactic training, talking at people, and that's what we call training. It astonishes me, particularly in health, what is often referred to as training. Just telling people, talking at them. What we know from research is this, however interesting it might be, it has no bearing whatsoever on work performance. Because the difference between sitting in a classroom and being in the workplace, you might as well be on different planets. It doesn't work. And yet we still do it. So effective training strategies need to follow staff right through into the workplace. You need to be able to demonstrate. So the 3 levels of training is verbal, that staff can tell you what it is they need to do. So not just listening to you, but able to say back to you what they need to do, their understanding of what they need to do to provide the prescribed level of practice. The next level is actually testing it out. Not in the setting, but in a safe environment. Role play. Now, a lot of staff, just cringe as soon as you mention role play. I do, actually. Not my favourite activity, but every time I've actually done role play with staff, teams, some have been dragged kicking and screaming, but every time I've done it, people have come up to me every time and said afterwards, God, it really makes sense now. Everything falls into place. I don't quite understand that, but it's been said to me every time, so I have to take notice of it. Actually acting things out, trying things out. We have a bit of a laugh as well, don't make it serious. every time staff have said it actually makes sense, much more sense when they do role play. Some services will do that. Most services, if they go anywhere, will do the verbal stuff. Some will do role play. Very few will actually do the in vivo, the actual training of staff in the workplace. Those who went to Christine's workshop will have learned all about the interactive training, which is what the in vivo training is. So the in vivo training is that staff can accurately implement the plans in the workplace, supporting the people that they have been employed to work with. Doing that actually allows trainers, managers, to be giving positive feedback to staff on what they're doing right, rather than focusing on what they're doing wrong. Someone asked me in an earlier workshop, what about when you've got to give negative feedback to staff? Because sometimes you do. What I found, every time again I've done interactive training, the in vivo stage of training, is that if you ask staff, if you start off by giving feedback, it's individual feedback, and you start off by asking staff, well, how do you think that went? Invariably, staff will be so self-critical that what you have to do is say, actually, you did quite well, because you did this right, you did that right, you did the other right. I very rarely had to bring up anything that staff may need to improve on, because staff are just so self-critical when they've been observed. So that is a very important aspect, and practice leaders should have a real key role in delivering that training, that 3-level training. They are there on the ground all the time. They can then induct new staff, they can use that training to set the whole thing in motion to begin with. How am I doing for time? Okay. Okay, now I'm going to... Any questions over the training strategies yet? A lot of people will be familiar with that. Okay, now I'm going to get on to things that you might not be as familiar with, and it's the accuracy and the quality bit. As I said, we think that these are key tools within the practice leadership arsenal. One is called positive monitoring, and that's a method for checking accuracy of implementation, and it's also a method of giving staff regular positive feedback in a very similar way to interactive training, the in vivo training. The other thing I'm going to talk about is periodic service review, which some of you may have heard of. And this is a method for setting standards to improve service quality. And it's not something that comes from above, it's something that is done with the staff team, so it actually increases ownership. Now, Sandy said, you know, I'm getting old, basically. Oh.
I can put it like that.
Means the same thing. Now, as you know, active support goes back to the 1980s, before it was called active support, got revived in the 1990s. These two methods as well, positive monitoring, goes back to the late 1970s. It was introduced in the Nimrod service, but that goes right back there, but very often it's not used. Periodic service review is Lavinia et al. That goes back to the mid-1990s. So although these things have been around for a while, they aren't very well known and they aren't very well used. But like active support, they are still valid, and they're very valid. And there's kind of a revival of interest in active support. It's all post-Winterbourne. This is why it's all happened, because people are so keen for things like that not to happen again. So there's a lot more interest in improving quality, etc. So I'm going to go into positive monitoring first. Now, positive monitoring, again, this is for practice leaders. Key components. First thing you've got to do is actually define and clarify the service aims and outcomes for service users. You need to know what the service is trying to achieve for the service user. Also needs to be very clear, very specific about what we want staff to do in order to achieve those service aims. The role of positive monitoring as well is to help staff work in that specified way. And the only way that can be done is by observing, by regularly observing staff while they are supporting individuals. Not just observing them, but it's also providing specific feedback to individual staff members in private. And it's good to get feedback. It's a terrifying thing, but very often people come out of it and say, I feel 10 feet tall. So it's a very rewarding thing actually to do. And therefore you're reviewing individual job performance, but in a very constructive, positive, congenial sort of way with staff. So, and this comes after the training, so this is the shift of management attention into ongoing quality. So, positive monitoring is based, it has to be based on regular observations of staff. And we're talking about all support staff. So managers, practice leaders need to work their way through the entire staff team. Has to be. Now, this helps managers stay in touch because they might have done the training. You could do very, very detailed training. You do wonderful in vivo training. But again, if you leave staff to carry on with it, you know, we all stray, don't we? We go off course. So it helps managers stay in touch with staff, to stay in touch with how they're operating, regularly observing them. If you don't do that, it's very easy for small little problems to grow, not to get noticed, little inconsistencies to develop. So these things need to be prevented. Also, observation should colour all elements of the PBS plan or active support plan, whichever support plan it is that is being followed. The observations need to be structured, systematic. They need to be measuring what it is we want the staff to do in order to achieve those stated service aims for each individual. That means that any observation needs to be directly related to what's written in the plan. And one way of doing this, or the best way of doing this, is actually to construct a positive monitoring form by systematically going through the plan and picking out key elements that you make sure staff need to be able to do and need to be doing on a consistent basis in order to put those strategies, those prescribed strategies into operation. It's good also to involve the staff team in constructing a positive monitoring form, because the staff are going to have very good ideas of which bits are really key. If you try and put every tiny little aspect in, you're going to get something which is a bit unwieldy. So if you get staff to involve, it gives them ownership as well, to identify the specific bits that they think these are really key elements. If we get that right, then the rest will follow. So basically it's working your way through the plan and identifying the different elements of positive interaction, identifying the key primary prevention strategies, the key secondary prevention, early indicators, etc., and the reactive strategies. So I'll give you an example of what one might look like. So this is just like an extract that shows you. You would have individualisation, you'd have the staff ID, service user ID, etc. on top of this sort of form. But it would have things like daily participation plan, one of the active support things, that's been followed. John is supported to prepare, this particular service user, John is supported to prepare his own breakfast. Activities have been planned for the morning or early afternoon, or late afternoon. Calm tone of voice, not raised. Interaction with John for at least 5 minutes within every 20 minutes. If an activity is cancelled, a reserve activity was offered. So on and on throughout the whole of the plan. What happens then when the manager does an observation? They're not unannounced. You don't spring it on staff, you actually plan it, so staff know that this is going to happen. Basically, during the observation time, the manager casually just observes and notes down that during the period of their observation, could be an hour and a half, should they have seen that action? And if they should have seen it, did they see it? Simple as that. You know, some things won't be relevant all the time. You know, for example, that one, reserve activity offered if cancellation. Well, if an activity hadn't been cancelled during my observation, then there's no way I'm going to see that. So that's basically, it's quite simple, but that's the basis of the observation. And if something hadn't been seen, you can just make notes, like John supported to prepare own breakfast. Now, it shouldn't have been implemented, and actually I make a note to myself, because actually, under normal circumstances, I would have seen that, but he has his breakfast early today. So you just make notes for yourself as you're going through. At the end of that chart, you come to like a summary section. And basically you get, it's very simple, you get the number of actions that I should have seen during my observation and the number that I did see. And I get a percentage score, very simple percentage score. But also, I've noted down all the way through, managers have noted down all the way through the different things that you've seen, the different things that you should have seen. You can actually note some really good practice as well. So you actually note comments down. Overall comments, you know, pretty good, 84%, pretty good implementation fidelity there. Areas of achievement, I can go through right back through that form and note down so many things I could actually give praise to the staff member for, because they did this. I've got so much stuff noted down there. Areas of need, yeah, I may have noticed one or two things, but again, okay, the staff might have already highlight that themselves, and any required actions, if any, and the next observation date. This gives practice leaders a script for giving tangible feedback to their staff, with the emphasis on the positive. Okay, I'm going to move on now. And again, when the people who come to the measuring outcomes workshops, percentage scores, the same thing applies to all the other measures of service achievement and stuff that I was talking about there. Now I'm going to come on to periodic service review, because I've only got 5 minutes left, and this is about quality. So PSR for short, it's Lavinia et al. 1994, and this is a measure of how well the team is doing against agreed objectives or against agreed standards. So you actually involve the team in setting those PSR standards. They're not imposed on high. It doesn't work if it's imposed from on high. It makes it like a stick rather than like a carrot. And I know that from experience. So basically, setting standards, you work with the staff team, practice leader works with the staff team. We need clear statements of, again, key standards, key things that should happen, which are measurable. They have to be measurable, that have all the key people involved, and they need to be written in performance terms, not fuzzy little terms, but actually clear, measurable terms. So they need to specify what should happen, when it should happen, who is responsible, and how do we know that it's happened. And again, I'll give an example. So, an example here. A completed positive monitoring observation form, which we've just seen, that was administered within the last 5 weeks by the manager and shows a total score of 85% or over is available. So by that, I know that positive monitoring has been done by the manager within the last 5 weeks, and the staff member has done really well, and I can see it. There's evidence of it. It tells me a lot in one tiny little standard. Another example, a functional analysis report can be produced showing the last date when it was reviewed is within the last 2 months. These are standards that a staff team will actually set for themselves, knowing that they want to implement PBS appropriately. So staff meetings, minutes show that a staff meeting following a preset agenda has occurred in the previous 28 days and was attended by 70% of the staff team. How much does that tell me about the organisation? You know, that staff meetings are being followed, they are happening, they are agended rather than everyone sitting there for a moan and a chat. And it's happening regularly because it's happened within the last month, and the majority of the staff team are there. One standard. You get the idea? So you can actually set quite smart standards. You don't have to set standards for everything. I'm going to move on quickly. Okay. But each of the standards need to be verified. It's not just what staff say. You have to produce the evidence. So either it can be observed or it can be seen in a permanent product. So it doesn't mean extra work for the staff team, because it should always be based on things that are normally, that should be happening within the service. So, and what we say is that the scoring is easy. 1 if it's occurred, and O for opportunity if it hasn't. So it's not a 0, it's not a 0, because again, this is not supposed to be a stick to hit staff teams. What we find actually, staff teams, if it's done well, staff teams actually get quite competitive. They want to do better than last time. They often want to know, well, what's the other services and what the other settings in this service got. What you wouldn't want to do is set one setting against another. But sometimes what you can compromise with is have like an average score across all settings, so people do want to kind of map how they're doing against other areas. But it's O for opportunity, because anything that hasn't been achieved just shows that there's opportunity for improvement, opportunity for change. But to do it properly, it needs to be flexible, it needs to involve staff. And it's something that actually staff will, if it's done well, staff will take on themselves and really run with it. And be monitoring one another as well, saying, oh, no, you've got to get that done. You're going to let us down. That has to be done. Or I have to do it because I'm going to let everyone else down. So it is something that really works and actually can be quite good fun if it's done properly. So, last slide. Lavinia, 1994, I think probably in desperation, said those who don't know how to manage are managing those who don't know what to do. Desperate kind of situation. And actually it is that situation that led to the development of these tools, which we say are the practice leadership tools, the 3-stage training, so you actually take the training right into the workplace, positive monitoring to ensure accuracy of implementation, and periodic service review to ensure and maintain and build quality. So managers who are skilled in these are no longer administrative staff. They're no longer administrative managers. They know how to do the job themselves, which actually gives them street cred. They have credibility with their staff team. They use evidence to give feedback, not hearsay. That is a killer with staff teams if managers just go on hearsay, because you get pulled in by skewed elements of the staff team. And again, we've probably all suffered from that. So they use evidence to give feedback. So it's really upfront, right up front there. And they actively involve their staff in the whole process of maintaining service quality and developing service quality, which gives the whole staff team ownership. And this is when you can truly say that these are practice leaders. They're not just managers. They really are practice leaders. And these, I don't think we can embed PBS processes, embed active support, embed high quality work approaches within our services unless we have practice leaders. I think they are the key. They are more key, I think, than making sure every support worker gets trained, because practice leaders can do that training. They can carry that load of staff turnover, of keeping things on track, of staff inconsistencies. They're pivotal, basically. And there are tools to help them. So I think that's about it. Thank you.